What should you expect from a good primary care physician in 2025? Meaning, in our current modern healthcare system, what's the value of a good primary care doctor? What should they do for you, and what should you expect of them? My name is Mohammed Ashori, MD. I'm a board certified family medicine physician, and on this channel, I focus about healthy aging. I talk about all the important aspects of health and well-being that we need to get into a good ripe old age with the least amount of pain and suffering. So let's talk about these three things that are probably the most important three things that a good family medicine physician should do for their patient. So number one, I think it's necessary for them to support you. You should feel supported by this person. Number two, they have to be able to manage your health. So navigate healthcare and manage all the different aspects of your health. And number three, they have to get to know you well enough that they can decide if you need some other intervention, some other testing. So with these three things, let's dive into one in detail, and you can sort of try to figure out what then you need to look for in a good primary care doctor. So a good primary care doctor is going to educate you, they're going to empower you, and they're going to guide you. I think a good family medicine doctor, for example, one of the best things that they can do is try to give all the right information to their patient so that that patient feels empowered and educated enough to make the right decisions for themselves. And that education piece, of course, doesn't need to be that old paternalistic style of medicine that we're accustomed to. It should really be a sweet, flowing conversation. Many of the patients that I have in my practice now, I genuinely love them. I have gotten to know them. We text each other. We have gotten to know each other's style. The empowerment part comes with time. Empowerment comes from believing that the actions you take in your health have real outcomes, have desirable outcomes. It also means that if you do the wrong thing, you might also have a negative outcome, but let's focus on the positive. And the guidance that I think a physician can offer you, a family medicine physician, an internal medicine doctor, anybody who's your primary care doctor, the guidance they can offer, this support, comes from being able to direct you, being able to know how much more of this do you need, how much more of that do you need. When you're dealing with a really tough health situation, can they push you to do something else that's even more complicated, or should they kind of let off the gas and let you just handle the situation? The next one is managing your health. So of course, a family medicine doctor, a primary care doctor needs to manage your health. A good primary care doctor is somebody who can say, all right, Mo, come on, let's talk about your health. Oh, you got this new acute health situation. I know the best specialist to refer you to. Let's get that information from the specialist, and then together, let's go back to the support, let's go back to the guidance and help you decide what the next best option is for you. Because there are so many treatment options available in healthcare these days, and there's a lot of things that is influenced by money and all this other stuff, commercial interest. But that primary care doctor and that patient together, that patient-doctor relationship that they've formed it with the intent of doing whatever is best for the patient. And the doctor has to get to know you. They have to understand what your preferences are. What is your definition of health? How long do you want to live? How well do you want to live? Are you willing to take medicines? Are you willing to undergo maybe a painful procedure or surgery? Some of my patients, absolutely not. They will do anything to avoid Western medical interventions. And then others are like, no, I think I'm okay with that if I absolutely need it. Your primary care doctor, by supporting you, will get to know you, and then they can help properly manage your health. And the last one is just looking ahead. This one is maybe more straightforward, but at the same time, it requires the art of practicing medicine. For my patients to experience healthy aging, I have to look ahead at their risk factors. I have to know what risks they're at highest risk for, what conditions they're at the highest risk for. And I have to be able to design tests, lifestyle interventions, discussions that we can kind of both undertake that might result in a better outcome for that person, because many interventions, even some cancer screening tests, don't actually extend your life. They don't really have a big impact. But if I really get to know my patient and I understand their risk, I can maybe make better decisions. Of course, it requires a little bit of nerdy research into science topics, but most important is to, again, be able to support that patient and know what is priority in their life, and then help them make that decision. So tell me how you have chosen your primary care doctor. How do you go about choosing your primary care doctor? What is important to you in your primary care doctor? That's it, guys. Check out drashori.com and leave your comments below.